Dr. Sarah Fox. I'm a family medicine physician and I practice women's health and obstetrics care in Mineral Point and Dodgeville for Upland Hills Health. I see women for all sorts of reasons. I see people throughout their reproductive journeys. I take care of people who are pregnant and people who are postpartum. And then I see people through perimenopause and menopause. And a lot of the things that I'm seeing people for recently have been related to menopause related questions. Some of that is because it's been talked about a lot more in the media. And so a lot of people are just having that conversation and understanding what of my symptoms might be related to perimenopause, and are there things that we could do from a medical perspective to help to treat those or manage those to prevent more problems down the road. Yeah. So a lot of perimenopause questions related to things like hot flashes or cycle length changes, or sometimes aches and pains can be related to perimenopause. Certainly a lot of people struggle with some metabolic changes around menopause, and so we definitely see a change in cholesterol levels and blood sugar levels and weight gain around menopause. And so sometimes people are coming in with frustrations related to that and kind of wondering, are there things we could be doing to help manage these symptoms? So I think it's just a good idea to bring up with your physician that you're having symptoms and you're wondering if they might be related to menopause. A lot of them are more obvious, like those hot flashes, but some of them are a little bit more subtle, and so sometimes it might take asking the question, is it possible this is related to perimenopause? Of course, perimenopause doesn't cause all the problems, so sometimes we hear from patients who are maybe wondering if perimenopause is causing something or menopause is causing something, and there's really actually something else going on that we need to chase down. So it's really important to not just assume that all of your symptoms can be attributable to perimenopause and menopause, and start to have a good conversation with your healthcare provider, with your physician, to see what needs to be checked out versus what maybe could be improved with menopause treatment. The age is really pretty variable for a lot of people, and we're also seeing that this can take a very different timeline for different women, and so sometimes we're talking about a very brief period of kind of transition from the early reproductive years into perimenopause and menopause. Some people hardly have any symptoms at all, and some people are really bothered by symptoms, and it could be a prolonged period. So it's really that there's no one size fits all for menopause evaluation, no one size fits all for menopause treatment, and so we really have to take each patient individually, start to figure out what are the most bothersome symptoms, and also risks and benefits of any treatment, and specifically for that patient, what makes sense for them. So I would say most of our treatment related to menopause is related to symptoms, and so any one age doesn't really help us decide where somebody's at in their menopause journey. Typically, we're talking about people in their 40s somewhere having that perimenopause transition, but there can be a lot of variability in that, and it's not a one size fits all kind of deal. This type of care, women's health care, should be part of our primary healthcare system. So this should be something that everybody's primary physician should be able to offer and serve to people. There are certainly people who become subspecialized experts in certain things, where if I have somebody who has a very specific complication that I really need to have some expertise on, we have those people that we can access, but it really should be something that is integrated into the healthcare system and part of primary care for all women. When we talk about any kind of delays and transportation as a barrier for people getting the care that they need, we really are talking about maybe potentially a lesser level of care or delays to diagnosis that could be very important for people. So really, women's healthcare is an integral part of family medicine in particular, and Upland Hills Health in general. Many people come in with some preconceived notions about how they will be treated in the healthcare system related to things that they see on social media, or they come in maybe with an idea of what treatment they want to see. And it's really important to have an open and honest conversation with your physician, with your healthcare provider, to see where your goals are and figure out what types of treatments would or would not get you closer to those goals. Not everything that we see on social media or that we hear about in the general media even is really right for every woman. And so it's really a strength that we have in family medicine and in primary care is that we get to know our patients very well. And so sometimes we can ferret out different things that might be helpful for a patient or not helpful for a patient based on what we already know about that person. So that's one reason why family medicine and primary care is really well suited to be the primary champion for women's health, is because it's integrated into the rest of our care for that woman.